Anemia is a condition in which the body does not have enough healthy red blood cells that can be transferred to the body's tissue. There are many different forms of anemia, and each have their own effects and causes. This will cause people who have this condition to be very tired or weak. They will experience fatigue at a higher rate. Sometimes anemia cannot be noticed, the symptoms are so mild, but it can worsen if the anemia gets worse. A doctor should be seen if symptoms worsen over time. Ways to avoid getting anemia is by eating a healthy diet.
Anemia affects approximately 6% of the U.S. population and 1.6 million people worldwide. Women, young children ages 6 through 12, and individuals with long-term chronic diseases are at higher risk for the condition. Anemia may be passed down through your genes. However, in older adults, they are at higher risk because of kidney disease or other chronic conditions. Iron deficiency anemia is more common amongst women because of their blood loss from their menstrual cycle. According to the WHO, the global prevalence of anemia is approximately 24.8%. Anemia prevalence is similar in that of the US, Canada, and Northern Europe, with men having a 4% prevalence rate compared to the 8% that women exhibit.
The American Academy of Pediatrics recommends infants be screened sometime between 9 and 12 months of age. Other at-risk groups such as expecting mothers also undergo screening. An anemia screening typically involves a complete blood count. In 2013, the World Health Organization authorized Resolution 65.6, setting a variety of nutrition goals to be met by year 2025. Of these goals is cutting the anemia cases in women of reproductive age in half. The most common type of anemia is iron deficiency. Many forms of treatment exist, including an iron-rich diet and vitamin supplements such as folate, vitamin B12, and C. Unfortunately, those suffering from food insecurity might not afford vitamins or a nutritious diet. It appears measures being taken today have been successful, as anemia prevalence worldwide has decreased 6.2% from 1990 to 2019.
The AAP, USPSTF, ACOG, FASEB, and the USPHS have all published guidelines since 1992 for healthcare providers that address screening for and treatment of iron deficiency in the U.S. Preventing and controlling iron deficiency are also addressed in Nutrition and Your Health dietary guidelines for Americans.
Information regarding anemia is generally accessible through different mediums such as health-related websites, medical textbooks and journals, as well as public health campaigns. People should visit their local clinics to confirm a diagnosis via a blood test. Treatments might include pain medication and blood transfusions. The most popular misconception about anemia revolves around nutrition. The best way to deal with the misconceptions regarding anemia is to expand access to education and healthcare. A diet low in iron might cause anemia, but genetics can also play a role in the case of sickle cell anemia. Moving forward, it is important that people remain informed and proactive when it comes to their health.